While the numbers are finally starting to decline, more than 74,000 Americans are still dying every year from opioid overdoses. Despite that, very few people struggling with addiction get treatment. Tonight, William Brangham looks at the renewed focus on methadone, one of the oldest and most effective medications in this fight.
They give me 27 days at a time.
For Natalie Knight, what's in these little white bottles has turned her life around.
It's nasty.
That pink liquid is methadone, and it's helped her tame an opioid addiction that she has struggled with for close to a decade.
Actually, such a small amount, but it really is, it's amazing that I don't get the highs, I don't get the lows, I don't get anything that I would get on a normal opiate.
Her path to addiction was like millions of others. A legal opioid prescription to help with chronic pain caused by an autoimmune disorder and a difficult pregnancy. At first, it really helped, but within a few years, she could not stop, and her life began to unravel.
I was still trying to be a wife and a mother, which I was failing at both, and I was not able to hold a job because when you run out of pills every 3 days, opiate withdrawal is excruciating. It's excruciating. And you're sweating and freezing at the same time.
I can't imagine doing anything like that.
Yeah. And every single day revolved around finding what I needed, even if it was just to get me through the next day. I got him as a puppy.
She tried several other treatments, including Suboxone, a medication that helps curb the cravings for opioids, but it wasn't enough. So last year, she was prescribed methadone. It's a potent opioid itself, first approved for drug treatment in the U.S. in the 1970s.
If I hadn't made the move when I did, I don't think I would have been living much longer. I don't think I would have lived today. I should have died 100 times over.
But for many Americans battling opioid addiction, getting methadone isn't easy. It can only be prescribed in federally regulated methadone clinics, and nationwide, there are only about 2,000 of them. 80% of U.S. counties have none.
Okay, well, because you're still working 2 jobs?
Yeah.
So once a month, Knight makes the trip from her home in rural Utah to see Dr. Paula Cook. She's the medical director at the Moab Regional Recovery Center.
How's the methadone going?
I don't have any withdrawals.
This clinic has only been here for 2 years, and before it opened, the nearest one was 120 miles away.
We're unique. Very few rural towns have a methadone clinic. Some states don't have a methadone clinic.
In these clinics, patients often get other services like counseling and behavioral therapy.
That's your blood pressure before you take your methadone, so that's probably after you take it, it'd be a little lower.
And decades of research has shown that methadone can cut the risk of overdose death by nearly 60%, and that people on it are 4 times more likely to stay in treatment. Given all of that, why is methadone still so hard to access?
Because it is an opioid, so we're giving someone a substitute therapy, which in essence is somewhat true. You're giving them an opioid to treat an opioid addiction, but the outcomes are very different. Most people who get on methadone actually stop using illicit opioids. They actually retain in treatment and get a job and stop going in and out of the criminal justice system.
The very first day I went to my methadone clinic and I'd taken my first dose, I was walking back to my apartment and I was like, my God, I'm not gonna get dope sick today. And I'm not gonna have to do any of the stuff I have to do every day to alleviate that dope sickness. And not only that, they're gonna give me another dose tomorrow.
David Frank has taken methadone for nearly 20 years after he became addicted to heroin in the 1990s. Today, Frank is a research scientist at New York University who studies opioid use and drug policy. He credits methadone with helping him get his PhD and turning his life around.
What about the argument that you often hear that you're simply substituting the addiction of one drug with the addiction to another drug?
It's almost like, so what? When I got on methadone, I swapped taking an illegal, criminalized, stigmatized drug that was very difficult to access and could only be obtained on an illegal market and never with any kind of knowledge about what your dose would be, for a consistent, stable, legal drug that I can access every single day at my methadone clinic or from my take-home doses.
For decades, because of fears that people would take too much or sell their doses, most patients were required to show up every day at a clinic to take their methadone under close supervision. Many patients criticized those rules, saying they made it extremely hard to hold down a job or live a normal life. But this October, emergency measures that were introduced during the pandemic
You are all set.
were made permanent in many states. These rules give clinicians more flexibility to let patients, like Natalie Knight, take home up to a month's worth of methadone at a time.
It's a gold standard evidence-based medication. We don't put barriers up for medications like insulin. We allow people who have diabetes to have access to insulin, and we don't require them to participate in an antiquated system that's stigmatizing, that some people can't access at all, actually, because of the nature of their condition.
Last year, a bipartisan group of lawmakers introduced legislation that would allow more doctors and specialists to prescribe methadone and would expand the kinds of places where patients could get it to places like pharmacies. But that legislation stalled amid concerns among some in the medical community that loosening methadone safeguards could backfire.
People who are just starting on methadone are actually at a higher risk of overdose for the first couple of weeks than before they even started on this medication. So the initiation of this medication can be quite tricky.
Dr. Kenneth Stoller is an addiction psychiatrist at Johns Hopkins University, and he directs an opioid treatment program in Baltimore that prescribes methadone. He says it is not a silver bullet on its own, that people battling opioid addiction really benefit from the additional support clinics often provide.
If people are getting medication within a setting that is not addressing their needs, their social needs, their medical needs, their mental health needs, all the barriers to treatment that they have, their outcomes just won't be as good as if people were going to comprehensive treatment.
You also hear concerns about methadone from within the recovery community. Some argue it's still a drug, and getting off methadone can be as difficult and painful as trying to quit other opioids. They argue abstinence through programs like Narcotics Anonymous is the better path. Some others who've used methadone paint a more complicated picture.
Getting on methadone saved my life. Getting off of it gave me a life.
He was revived with Narcan from someone from our team.
We first met Ryan Duxbury back in 2017 while reporting on the opioid crisis in Rhode Island. He took methadone for 6 years to get over his OxyContin addiction. He eventually got off methadone and now credits his sobriety to abstinence and support from peers.
I had to go to the methadone clinic in a fairly seedy neighborhood, and I had to be there every day. Still, I'm trying to find recovery, and I'm trying to change my environment a little bit, and still standing in line outside in the cold with people that I used with wasn't very helpful.
Do you think if you'd been given 30 days worth of doses to take home that would have helped?
I do think that would have been better for me, but I wished that there were more support in terms of me being able to, become more productive as a member of society.
So are they going to send her with some medication?
Back in Utah, Dr. Paula Cook says today, because fentanyl is so prevalent and so potent, increasing access to methadone is critical. It's why she supports allowing it to be prescribed outside of clinics like hers.
All right, yeah, come in, have a seat. Is there a risk? Of course there's a risk. That's why it requires good stewardship. But I'm 100% sure it's the right path because that's what the evidence shows, and it's what people who have opioid use disorder have demonstrated. And improving access will reduce loss of lives.
Natalie Knight says methadone is slowly helping her rebuild her life. Could you have envisioned who you are today and how you're living today?
No. I never envisioned that I could have a life like everybody else has. I'm able to work 2 jobs and not go through withdrawal, but also not be in pain. I am able to be a mother. I am able to be a sister again. It's changed my whole life.
For the PBS NewsHour, I'm William Brangham in Moab, Utah.
Tomorrow, we'll look at why medications are so rarely prescribed for people who struggle with one of the most commonly used and deadliest drugs, alcohol.